Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another live edition of COVID-19 update with ITV Networks. It is a Tuesday morning. It is the 13th day of the blessed month of Sha'ban 1441, the English date being the 7th day of April 2020. With regards to the COVID-19 update show, Monday to Thursday, 10 a.m. to 11 a.m. And don't forget our medical, more focused show on the coronavirus, Health Matters Extra, at 4 p.m. Every day here, live on ITV Network. So that's something to tune in with regards to the medical aspects of COVID-19. We see in South Africa at the moment 1,600 plus cases confirmed with the coronavirus. We see 12 confirmed deaths also related to the coronavirus. So we'll keep you up to date also with our news bulletins throughout the entire day with regards to what's happening here in South Africa with regards to the coronavirus pandemic. On the other hand of things, not only does the coronavirus affect those in people who are healthy or unhealthy, etc., but it is not only a medical condition. When we look at South Africa at the moment, we are in day 12 of the lockdown. There are many implications with regards to this lockdown. And one of those implications is the economic implications that this lockdown will have on South Africans and many of the lower class in formal settlement areas, etc. So this morning we're going to be speaking to the president of the Minara Chamber of Commerce, and that is Solly Suleiman. We say Assalamu alaikum wa rahmatullahi wa barakatuh to you, Solly, and Jazakallah for joining us this morning.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you for having me on the program this morning.
Alhamdulillah, it's been a pleasure for us to interview and get a better understanding of what the lockdown implications will be with regards to our economy. We see a press release from the Minara Chamber of Commerce discussing this impact that the lockdown will have on the economy. First, let's start off from there. What is the impact that this lockdown will have on the economy of South Africa?
I think it's important for us to now plan for post-lockdown, and I think this is where people seem to be kind of confused. The reality is the president, and I must commend the president and the Minister of Health for really taking the initiatives as a matter of urgency, and I think that's important. But the lockdown effectively ends on the 16th of April. Now, I think this is important because I know many people are speaking about the lockdown effectively being extended. For it to be extended, it's going to be catastrophic for the economy, as it is. There's thousands and thousands of businesses are closed, offices are closed, and people are not generating income. The last salaries people have gotten in the non-essential spheres of the economy was in March. Now remember, if you begin work on the 17th, then people must prepare for that. The people have to prepare for the fact that 17th you start business again. But the reality is, the salaries paid in April are really going to be very, very low. If you're going to get paid on the 25th, you probably get 10 days of salary. So I think it's important for us to start planning post-lockdown. Now, when I'm saying that, I'm not saying that we'll effectively open up the economy and everything is hunky-dory and back to normal. That's not going to happen. The reality is, on the 16th of April, the lockdown ends. But thereafter, we'll have to then plan from now. So people are sitting back and thinking, maybe they'll extend the lockdown. The reality of the lockdown is that we needed about 21 days. Remember, we had imported spread of the virus. We had the COVID-19 being brought from all over the world, and that kind of was a big challenge for this country. And we didn't actually close up our airports and our harbors and whatnot as soon as we should have. But having said that, the reality is now the internal transmission is where our challenge is. And people must understand, when you say lockdown and after 21 days, it's not going to stop. Not as if it's going to halt, but what we are trying to do is bring it to a manageable level. That's what government is trying to do. So effectively, there will still be spread of the virus post-lockdown. So there'll have to be a multiple number of initiatives and restrictions post-lockdown. But the fact of the matter is, what you're trying to do is reduce the spread of the internal spread of the disease. And if that happens, effectively, you then can control it to the level that your hospitals can cope. Remember, we've probably got maybe 5%, maybe 10% of the beds we need in both the private and public sector. So if you don't really manage that process of the spread, I know people are saying, no, let it be like Norway or Sweden or whatever, just basically herd immunity. Not going to work in South Africa because we've got a lot of poor people, low-income people in the townships, in the informal settlements, and we need to find a way to really ensure that that thing doesn't spread like wildfire. Remember, if this thing spreads as based on the herd immunity, you're talking about millions being sick. You're talking about hundreds of thousands dying because we won't be able to cope. Doctors will have to play God. Those that are the most viable will be given the opportunity to be on ventilators. Now, I think the Islamic Medical Association is busy with trying to, address that eventuality if it does come. So the reality is going to be a catastrophic effect on the economy. Now, for example, our unemployment is in the region of about 30%. Now, if you take, for example, one entity, one corporate entity, Edgar's, 148,000 people being employed. I don't think they'll be able to survive. The day they opened, they would have lost 400 million last month and about 800 million this month. So it's 1.2 billion. They won't be able to pay the creditors. And what's the effect of that? You don't pay the creditors, there's thousands and thousands of small businesses, the CMT manufacturers that are not going to get paid. So if they don't get paid, then what happens to the the employees? Those businesses will, so it means a ripple effect. You got Edcon closes up, 148,000 jobs. Every other CMT that's supplying them will not get paid. They can only pay salaries, I think, at the end of this month, because they would have, as I said, lose about 1.2 billion in turnover. And then look at the ripple effect. Landlords won't get paid the rentals. Landlords will then have to renege on their contributions to the banks. So I think the reality is we need to sit down while we're sitting at home and think about these things, because we're talking about this thing is not going to be a thing that ends on the 16th of April. This spread of the virus will continue. We hopefully it doesn't spread as much as fast as it's been doing now. And of course, the reality is there'll be multiple restrictions in place. We have to accept and understand that. But when you look at, for example, the different industries. Now, if you take, for example, the travel industry, the transport industry, I mean, airports, really, all the shops in the airports are not they're not doing business right. The airlines are going to be in trouble. The tourism industry, the events coordination people. I mean, there's hundreds of thousands of jobs that are going to be lost, whether we like it or not. No matter what we do now, there's going to be that. So when we as a Minara Chamber debated this and looked at the different scenarios, we need to plan. Nobody's talking about what's going to happen. How do we plan over the next 3 months? This spread of the virus is going to be maybe another 3 months, 6 months. Let's take 2020 and call it a day. That's 2020 is gone for the spread of this disease. A lot of energy has been wasted right now on this type of process. I mean, so these are the type of things. So there's going to be catastrophic, millions, hundreds of thousands of jobs will be lost. And how do we kind of cope? Whether you're wealthy or not wealthy may not affect, we may be sitting in our comfortable homes. But if there are no people that are buying, then you're not going to do business. If you don't do business, you'll be out of your comfort zone. We all are affected, and every one of us has to play a role. Every South African, it's not just the Muslim community. I think from a Muslim perspective, we're looking at pettiness. We're looking at petty things, whether we should go to the mosque or not go to the mosque. Government says, sorry, all gatherings and all religious facilities are locked, closed, illegal to open them. Yet we're still debating whether we must open these facilities or not. So basically, we've got a lot of work to do as not only our community, but the entire country. Everyone will have to work together and find ways to ensure. Can you imagine in the informal settlements, in the blocks of flats, whatever, people at this point in time, the repercussions are huge. The learners are sitting at home. The adults are sitting at home. I mean, lots of people haven't been speaking to their wives or children for a long time. Now they're forced to sit and do that. And then suddenly you'll have massive, either bonding will happen and it's phenomenal, but the guys are bored. If people want to eat, where you probably had a single good meal a day, now you're having 3 meals a day. Because you're waking up and you're expecting your wife to be cooking and feeding you. And at the end of the day, she also has her own, limitations in a sense. It becomes problematic. So imagine the type of problems that are going to arise from this. So you've got multiple problems that will arise, whether it's social, whether it's from the security services, whether it's the employment, whether it's the feeding schemes. Because look at the moment, you've got feeding schemes going on at the moment. But how long can we sustain it? You've got 8 to 10 million people need to be fed. You're talking about 10 billion to 12 billion rands that will need it just for the next 3 weeks. Can we sustain that? If you can't sustain that, you've got thousands of hungry people out there. What happens then? How do we basically take care of these hungry people at least another 6 to 8 weeks? So there's a lot of really serious concerns. Other than you got the pandemic on the one hand, and you got the other pandemic, you can call it that, from economic point of view, that we need to address, and we need to address that now. We can't sit and say, no, I don't know whether we're going to have a lockdown extension or not. Let's work on the basis it was 21 days. Very highly unlikely the government can afford to make a decision to extend that lockdown, but they can make sort of provisions in the sense of restrictions. In other words, you need to say, okay, fine, you go to work, but between so and so time and so time, you have to be under curfew. There's a certain number of things. Essential services will all business except essential services will have to close by 6 o'clock in the evening. Masks are becoming a big thing now, even the cloth masks, fabric masks. The Islamic Medical Association is focusing on really getting people that are sitting idle at home to find ways to actually make these masks, because I think it's what they say at the moment, say a few months ago, they said if you don't need a mask unless you're a health professional or you're sick. Now they're saying, you know what, it's safer to just mask. And even if it's a fabric mask, let's kind of do that. Let's put on a fabric mask. At least it protects you to a point. It's not an end all or cure for the you probably can get the infection, but the fact is it would protect you to a point. It's limited, but so now the focus is mask. Everyone should wear a mask at this point in time to kind of cut down the spread of the infection.
Uncle Solly, you've been talking about the implications of the economy, especially with COVID-19. We see Italy are now announcing they're going to be injecting 400 billion euros into their economy to help struggling businesses. In your opinion, what is a government's intervention then with regards to the economy? I mean, we've seen what has happened to the dollar over the past a week or 10 days, etc., or to the rand, to other currencies worldwide. In your opinion, what should government's intervention be now?
Well, government has a number of interventions already in place. If you've got the funding mechanisms where it's the employers can actually basically request funding based if they impacted. For example, if you're a clothing factory or your clothing business, you obviously are impacted. You've got all these staff that are there that will need to be paid. So there is a mechanism for that type of thing. There's a relief scheme. There's also another scheme where they can actually request funds to get supplies. But now when you look at supplies, you've got a problem, because now the rand at almost 20 rand to the dollar, big challenge, because cost of everything gets more and more expensive. For example, I was looking at the pharmaceutical industry. Now lots of items, whether it's the raw materials or the completed goods, comes from overseas. You take the medical equipment, you take the masks and basically the gloves and those type of things. They come from overseas. So suddenly your price has gone up by 25%, or even more than that, maybe 33%. So your price has gone up. And then when you look at the pharmaceutical manufacturing industry, they govern. That means you can't go and increase your fees or your prices. It means if something costs you 10 rand today and it's suddenly costing 13, 14 rand, government governs that. So you can't increase it. So will they sort of import these things, or they'll wait for the items coming? If they don't import it, then you're going to be in there'll be a massive shortage of goods coming into the country. So I think this is important. So the impact is huge from that perspective. So government has a number of initiatives. For example, you got the temporary employee benefits at the UIF benefits at the moment, and I think the Minara Chamber has been posting this. It's on its website and that type of thing, where people can basically access this. For example, if you have been working and your employer can't actually pay you, so they will tell you, okay, either take paid leave, and it means you won't have leave in November or December or whatever you take leave. But at the same time, you have a situation where some people don't have leave, so they would have to take unpaid leave or go on short time.
I'm going to just have to cut you there. Apologize for that. We're just going to go for a short break, inshallah. When we come back, we'll touch back on to this point with regards to the paid and unpaid leave. We go for a short break, inshallah, here on the COVID-19 update. We'll be back shortly. Welcome back to the COVID-19 update show. We apologize for that. We were only being seen and not heard. Inshallah, all that is now sorted. Once again, we are talking to the president of the Minara Chamber, and that is Brother Solly Suleiman. Solly, before the interruption, we were talking with regards to government's intervention for the impact that this lockdown is going to have on the economy. You were touching on the aspect of people taking paid or unpaid leave, etc. Do you want to continue from there?
Yeah, no, as I said, there's different aspects to the interventions at the moment. And the one is really the funding assistance for businesses on the one hand, who can't really pay their employees. On the other hand, for the supply chain as well. And then there's other initiatives from the various departments, the Department of Labor, the Department of Tourism. So many departments, we've got a very comprehensive thing on, and if people want it, they can actually contact us, and we can basically put it onto the website. It's on the website, so we can actually send it to them. So basically, from an employee's point of view, you've also got the UIF fund, which basically you got something called TERS. It's a temporary employee relief scheme. So that's called TERS, which basically allows employees to basically go into the system, and there's a whole process to follow. So I think one has to go into the system and ensure you apply for these type of things, because let's face it, many businesses will not be able to pay for the employees. If you haven't done business, for example, you take the restaurants and takeaways and clothing shops and jewelry shops, whatever, they can't afford to pay their employees because they haven't been doing business. So there's a multiple number of schemes. So for example, there's a scheme with the Oppenheimer Trust, where you can actually submit, the employees can actually get basically apply. Obviously, the employee can apply on behalf of the employees. The employee gets a loan, but the employer pays it back. It's an interest-free loan. So there's many of these initiatives, really, as I said, for the Department of Labor, from the UIF, the CCMA is also involved in the process in certain areas. So it's quite a comprehensive list of initiatives. Now, as you said, Italy has given over 400 million euros. Now, unfortunately, in our country, the last decade of our leadership has caused a lot of damage, because billions of dollars or rands have been lost in the system. So we don't have the solid foundation. But with all that, the government is basically handling a number of initiatives. But the reality is, for example, if you were earning 20,000 a month, and the maximum that you'll get from the government is 3,500 to basically reimburse you for the loss of income. So there's going to be limitations. Everyone's going to have to take a sacrifice. Often, the employees feel that they wouldn't be able to take the sacrifice, and that's correct. Lots of them can't afford to take the sacrifice. But whether we like it or not, and this is where the problem arises, you don't have the money at the end of this month to pay for food and rental and whatever else, lights, water. It means you'll be reneging on your repayments. So your focus will have to be food rather than anything else. And then if you spend money on food, if you have money, because while you're sitting at home now, you're probably spending a lot more money on food than you normally do, then you're going to have no money to pay your rent. That means the landlords are going to be impacted, and that impacts on his ability to meet the bank's repayments. And if the bank's repayments are not paid, you're going to have repossessions. The repercussions are huge, really huge, and we need to kind of understand this and sit and ponder and say, what can we do as a community? What can we do? How can we basically, especially the privileged amongst us, need to really start thinking about it, because every one of us is going to be impacted. No matter what business you're in, you're going to be impacted.
Uncle Solly, also with regards to this topic, I know it's a topic I can see very passionate about. Unfortunately, time is against us this morning. The last question in the press release that the Minara Chamber of Commerce did release with regards to the lockdown, talking about it's going to be a rough ride for another 5 years or so.
Yeah. Well, you've got two things here. One is the coronavirus, and the other one was the state capture. We probably wouldn't have basically recovered from the state capture in the next 2 or 3 or 4 or 5 years. Now we've got the added problem of the coronavirus. So 5 years, I think we're being very optimistic that we can basically recover. Remember, our growth rate is negative now. I mean, we really, Moody's and all that have really put us into the category where that is not really, we're not in a positive position. They were probably hoping for us to be kind of zero growth, but I think now we're talking -1 or -2 or -4% growth means we're already in a recession anyway. So the fact of the matter, 5 years is kind of being optimistic, but that means a lot of sacrifices will have to be made. Government has to take a lot of initiatives. They must be very firm. The unions have to understand that they have to come to the party. These days of standing and saying no, but we want increases. Ain't going to happen. They have to take. There's going to be a slaughter in the job. So they'll have to take pay cuts to ensure they've got some job. So at the end of the day, I think the entire 5 years is, I think, being optimistic. I think it'll be probably more than 5 years, probably be a decade before we even get anywhere. But that means government has to be very firm. Unions have to come to the party. Businesses have to understand they're going to be impacted. They must have scenario planning. They must decide how they're going to work. Scenario A, B, C, D. Like just like the Muslim community regarding Ramadan, we need to do scenario planning. If we get to a point where there's restrictions, you might have restrictions 10, 20 people in a gathering. So if you're having Tarawih, how do we manage this process? You need to make a list of thousands of hufaz and have thousands of facilities to have small Tarawihs, So we need to be planning these things on right now. And we're not doing that. We kind of just looking at all the statistics coming out of from the Department of Health and looking at things overseas and what their different types of medication is and how many deaths are there. I think we really need to focus on the economy now. We know the government is trying to control the spread of the infection. Our role as the Minara Chamber and even the Islamic Medical Association is quite actively involved in trying to plan the way forward. It's never going to be the same, unfortunately.
President of the Minara Chamber, Salih Suleiman, Jazakallah for giving us some of your valuable time this morning and deep insight into the implications of the lockdown will have on the economy of South Africa. Please do remember us in your du'as. Allah subhanahu wa ta'ala grant you and your family goodness and well-being at all times and take you and the Minara Chamber from strength to strength. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
That was the president of the Minara of Chamber, Salih Suleiman, talking about the implications of the economy. We can see that this is a real problem that is going to be facing each and every individual in South Africa. And as the Salih is then talking to us, maybe for the next decade or so, the implications is going to be felt for the next decade in South Africa. But we turn to Allah subhanahu wa ta'ala and we ask Allah subhanahu wa ta'ala to make it easy for us at all times, inshallah. We go for a break, inshallah. When we come back, we're going to be speaking to a media host personality and a championship SA driver, that is Ashraf Garda, and we're going to be talking about a very important topic this morning with Ashraf, and that is the issue of fake news, something that has been going around tremendously now since the COVID-19 pandemic has been in South Africa. We find a lot of fake news going around. So inshallah, we're going to be talking more about fake news and the verification of real news and how do we differentiate between real news and fake news. Keep watching. We're now talking to Brother Ashraf Garda, Chief Driver of Champion South Africa, media host, professional speaker and media trainer. And this morning focusing on a very important aspect with regards to fake news. We say Assalamu alaikum wa rahmatullahi wa barakatuh to you, Ashraf, and Jazakallah for joining us this morning.
Wa alaikum salam and for
Ashraf, with regards to the issue of fake news, we see this has become a hot topic now with regards to the coronavirus pandemic or COVID-19 issue. How do we go about differentiating fake news from real news?
Well, I think interesting you say a hot topic. It's been 50 years now. I think the issue to pick up that fake news by definition is that not. So the question that why would people pass it on? There are two types of people. One part of news that's not true. People think because there is a
All right, Ashraf, I'm going to have to cut you there. The line is very terrible at the moment. So inshallah, what we're going to do is, inshallah, I'm going to apologize to you and the viewers. I think maybe we will unpack this issue tomorrow morning. Inshallah, we can get all the gremlins out of our system as time is against us. The line is terrible. I can't hear a word that you are trying to inform us with regards to fake news. So Ashraf, inshallah, we will be in touch later on in the day, inshallah, just to try and sort out how we can do this interview tomorrow morning. A very important aspect with regards to fake news and the issue surrounding real news and fake news and the implications of sending out fake news on social media, especially with the COVID-19 pandemic or the coronavirus pandemic, as we find what is happening not only in South Africa but worldwide. People have all become professors or doctors in their fields or in fields that we have no knowledge about, and then we end up forwarding messages that are not verified, and we create hype and hysteria and panic when that panic and hype should not be created. So inshallah, this is something that we need to discuss, a topic that needs to be discussed within our communities, within our families also, especially everybody is on social media nowadays. We need to be able to verify and filter what is real news and fake news. Inshallah, if you hold on one more day for us here on the COVID-19 update show, we'll be able to unpack that for you, the reality of what fake news does, not only to our community but to a society as whole, and the implications and the great disadvantages and the repercussions of spreading fake news. From a mu'min's, believers side of things, we know there are great implications and disastrous consequences when it comes to telling lies and then also forwarding lies or forwarding information that has not been verified. So from a mu'min's perspective, a person should always be, whenever we get some sort of information, some sort of news, the first question should we be asking is this verified from a reliable and credible source, before we hit that forward button, before we hit the like button, before we hit the share button. We need to understand that when we get any piece of information, and people will be getting thousands and thousands of messages now with regards to the coronavirus pandemic. In fact, on a lighter side of things, there are so many messages that people get on the COVID-19 on their phones. One wonders if our phones have not been infected by the amount of coronavirus messages we are all getting on our phones and mobile phones, etc. So we need to be very careful as to what we share, to whom we share, and how we share the information that we are receiving. Like I said, from a mu'min, from an Islamic perspective, disastrous consequences it will have on a mu'min, an individual, for a believer, to spread news that is not verified. So inshallah, do take care on that aspect at all times, inshallah. But definitely, inshallah, we're going to touch base with Ashraf tomorrow, inshallah, and try and unpack this on a more serious level and try and understand fake news and real news. Talking about trying to help the economy and the impact that the lockdown has had on the economy and on the people of South Africa, and what different organizations and communities are trying to do to alleviate the problems that many of the communities are going through. Yesterday we spoke to the Millie Drive campaigners or coordinators of what they are doing with regards to the Millie Meal Drive of 60 Rand a bag of Millie Meal to go out there and give to the lower class population of South Africa and different informal settlements, etc., where the most vulnerable are in need of food to be put on their table, etc. So this was a drive initiated by the Santon Islamic Organization and the Fordsburg Muslim Youth Foundation. So this morning, inshallah, we're going to be going to Durban, where we're going to be speaking to the chair lady of the Caring Sisters Network and what a campaign they are currently doing in Durban to help alleviate some of the suffering and the issues of the people out there in Durban. So we go for a short break, inshallah. When we come back, we'll be speaking to Sister Yasira Muhammad Suleiman, who is the chair lady of the Caring Sisters Network, and we'll be unpacking what the Caring Sisters Network is doing in Durban with regards to the impact that the COVID-19 and the lockdown has had on society. Keep watching. The last stretch of the COVID-19 update this morning. We're going to be going live to Sister Yasira Muhammad Suleiman, who is the chair lady of the Caring Sisters Network, and she is on the ground at a distribution point at one of the informal settlements in the Durban area. We say Assalamu alaikum wa rahmatullahi wa barakatuh to you, Sister Yasira, and Jazakallah for joining us.
Wa alaikum salam wa rahmatullahi wa barakatuh. For having us, and assalamu alaikum to all your viewers.
What's happening at the moment on the ground? We see a lot of activity on the ground there. Before we even want to touch on to that, Sister Yasira, just give us briefly what the CSN has been doing with regards to helping people during this COVID-19 pandemic.
Okay, alhamdulillah, the Caring Sisters Network came on board before lockdown. We decided to go on a food hamper drive because we knew obviously with the people who are going to go into food insecurities, what's going to happen with the lockdown. Obviously, people are not working, they're unemployed. The need is going to be great on the food side. So alhamdulillah, we launched our project just before Ramadan, just before lockdown, 5 days before lockdown, actually on Human Rights Day. And we decided with our drive, we launched it and we collected as much as we could before lockdown. Before lockdown, alhamdulillah, we distributed 1,500 hampers to people in need, to the poorer communities, to the lower socioeconomic communities, as well as informal settlements. Obviously, once lockdown was implemented, there was a bit of a challenge and a task. How do we get our hampers out? But alhamdulillah, Caring Sisters Network has become one of the COCTA accredited NGOs, and we got our permits and distribution started continuing. We are here today, like we've done many distributions like this, hands-on, in an informal settlement. It's an informal settlement on New Germany Road in the Reservoir Hills area. Today, we're handing out 500 hampers plus 500 fresh meals, as well as we've actually got a very different concept today. We're going to take you around and show you. We've actually issued given each person a mask, a reusable home mask, which we're going to be handing out now on every hands-on distribution that we do. Unfortunately, we cannot be doing these hands-on distributions, ground distributions every day. So to date, alhamdulillah, we've distributed 4,000 hampers to communities in need, working with other local leaders, smaller communities, working with community leaders, as well as other NGOs to distribute our hampers.
So, Yasira, the impact that your distribution has had on the people that you have distributed to?
Oh, alhamdulillah, you know what? Actually, I must tell you a little bit about our hamper. If you're going to focus a little bit there on the hampers, you can see we've got quite a big hamper. Alhamdulillah, we worked on getting the hamper to the families on need, 4 or 5, a family of 4 or 5, and this should suffice them for about 2 weeks. And the amazing response when you get to these people, you can see the starvation in their eyes, you can see the hunger in their eyes. Today, alhamdulillah, it's a cloudy day. When we did this distribution last week, we went out in the rain. It rain poured in on Wednesday morning. But you still see the people coming out in numbers. They come out and they stand in numbers in that rain, in the mud, just to get the one hamper that we're giving them. So that can tell you what the response is from the people, the needs, what poverty they're going through. It's, a lot of them are not contract workers, so they're not getting paid, no work, no pay. So alhamdulillah, from our end, we are doing what we can to help whoever we can, whoever is in need. But obviously, these people are the ones who are in need. You can see that they are not working. You can see their homes. We're going to do a very quick quiz to show you the homes behind us. They're all squatter camps, if you can see. Yes, many of them have the GSTV satellites, but alhamdulillah, it's all tent shacks, all squatter camps, all crowded. So obviously, we know that the virus has hit the townships in a big way. It's hit the lower socioeconomic status. And this is what we're going to be going through. People living 5 and 6 in a shack, crowded communities of 500 and 600. And this is where the virus is going to spread the fastest. So yes, the need is there both for the hampers as well as, I'm telling you, today if you look around, you will see each person collecting a hamper today is wearing a mask. So alhamdulillah, each of our volunteers have masks on, we've got shields on. So we are protecting ourselves, but we're protecting them as well. So we're getting into the communities to distribute these reusable masks as well as our hampers.
What has been the collaboration between local officials and the Caring Sisters Network?
Okay, so we are working with COCTA. As you will notice, if you look around, I'm going to get my cameraman here to focus a little bit on that side. You'll see the COCTA officials are all here with us. The guys wearing those khaki sort of jackets. So we're working very closely with government. Obviously, government is allocating us these wards and these districts. Obviously, they know with the informal settlements, they know where's the needs as well. So we're working very closely in collaboration with the government. I'm also working with other organizations, like I have Brother Ahmed over here from Impilo community who's helping me. We get many volunteers wanting to come on board, but unfortunately we are a bit restricted with respect to our permits and the number of volunteers we can come out with today. So today we have our volunteers here, my whole family, my 4 kids, and a whole lot of members from Caring Sisters Network who are assisting us today.
Lastly, Sister Yasira, alhamdulillah, mashallah, great work being done on the ground there. How do people get in touch with the Caring Sisters Network and become part of helping those in need?
Okay, alhamdulillah, I'm going to give you a bit of breaking news right now, which I was holding till the end. Last week, the Caring Sisters Network hit 1 million in funds, alhamdulillah, for a small network of women. And yesterday, alhamdulillah, we had another breaking record. We've just reached our 2 million mark in donations. So what I'm saying to everybody listening and whoever wants to donate, we're not stopping to distribute. We're continuing throughout lockdown. And remember, it doesn't stop when lockdown finishes. After lockdown, how many more people are going to be going through to their jobs? How many people are going to be re-employed? Economy is going to be low. Factories are not going to still be operational. So the need is going to continue. It's not only during lockdown. So we as Caring Sisters Network have decided we're going to continue to distribute our aid, our hampers, our fresh meals. I forgot to mention that today we are actually doing 500 fresh meals as well, all packed in containers. And we're going to continue as long as the need is there. But we can only continue if we have the funds coming to us. So please donate. Open your wallets this time. We're asking you and appealing you to look around, look at the poverty, look at the hunger, look at the need, and donate to Caring Sisters Network. And as long as the funds come in, we will continue to distribute our hampers, inshallah, to the most needy. Just to add a very quick aspect as well, we've also introduced our door-to-door service. We're working with the community, with the organization called Community Outreach, Itikweni Community Outreach, and Secure. They are doing our door-to-door deliveries for us. We have a whole WhatsApp system. People who are in need, who are housebound, who cannot get out, we are also doing door-to-door deliveries for them. So we at Caring Sisters Network are endeavoring to get to the needy, to get to the poor, to get to the housebound.
Right, it seems that she might have got a phone call because we're using Skype via the phone. But we've got the gist of what Sister Yasira Muhammad Suleiman from the Caring Sisters Network is doing on the ground there. Alhamdulillah, a great effort has been made with regards to helping those especially in need at this critical junction that South Africa is going through or experiencing with regards not only to the COVID-19 pandemic, but also the lockdown, the 21-day lockdown in South Africa. Today is day 12 of those 21 days of lockdown. So inshallah, Allah subhanahu wa ta'ala make it easy for one and all. We need to become an ummah that gives and cares for the next Muslim brother or sister, or care for humanity at a whole, or humanity at large, inshallah. And we ask Allah subhanahu wa ta'ala to always bless us, forgive us, and shower His infinite mercy upon us and the Ummah of Nabi Muhammad sallallahu alaihi wasallam. For verily, it is our turning to Allah subhanahu wa ta'ala. It is turning to the Quran. It is turning to the Sunnah of Nabi Muhammad sallallahu alaihi wasallam. It is the turning of giving out in the path of Allah subhanahu wa ta'ala that will bring about the mercy and blessings of Allah subhanahu wa ta'ala and goodness from Allah subhanahu wa ta'ala. And who knows, it will be our little bit of giving that will bring about that change, that Allah subhanahu wa ta'ala then will change what is happening, especially in the condition of the Ummah of Nabi sallallahu alayhi wasallam and the condition of humanity at large. Today being the 13th day of Sha'ban 1441, we encourage one and all to be increasing the amount of istighfar we make, the amount of durood that we make, and the amount of dhikr that we make on these blessed days as we move ever so closer to the blessed night of the 15th night of Sha'ban. Allahumma barik lana fi Sha'ban wa ballighna Ramadan. We ask Allah subhanahu wa ta'ala to bless us in the month of Sha'ban and make us reach the blessed month of Ramadan, inshallah. That's where we leave it for this morning from myself and the rest of the COVID-19 update team. Do remember us in your du'as. Take care. Fi amanillah, same time, same place, inshallah, tomorrow morning. Assalamu alaikum wa rahmatullahi wa barakatuh.